Are you sick of health insurance not covering the care you want to get to heal yourself? Are you tired of shopping around for a doctor who understands your condition only to learn that every doctor that seems qualified is out of network with your insurance and it becomes an almost entirely out of pocket expense? Or do you wish that it was just easier to find and pay for a holistic doctor who could actually heal you? If you said yes to any of these, this episode is for you. Since starting the Better Belly podcast in 2020, I've been trying to accrue a list of the best tips to make your healthcare more affordable while still getting the quality you want and honestly need with the care from doctors that you want. I've been sharing multiple episodes like episode 181, How to Make Health More Affordable with Catherine Pomerantz, who is a financial advisor, and an episode with my dad, who's a surgeon, who broke down why health insurance works the way it does and how to still get the most out of your health insurance in 2024. But today, I'm doing something I've never done before. I am sharing the exact numbers that me and my family have paid for our health insurance at different stages. I'm also sharing how we get all of our functional medicine appointments and labs covered by health insurance with our current health insurance provider. This is a bombshell health insurance hack episode that health insurance companies do not want you to know about because basically you will no longer have to rely on them. So if you're sick and tired of health insurance, hidden fees, and over-the-top costs of healing, then this episode is for you. Hey friend, welcome to the Better Belly podcast. If you're currently trying endless supplements, doctor visits, and diet changes to heal your mystery symptoms, you are in the right place. We're here to solve the real root causes behind your gut, hormones, skin, sleep, and brain concerns, literally anything and everything in your body. My name is Allison Jordan. I'm a functional medicine practitioner that has supported over 150 clients just like you to heal problems that no one has been able to fix. You don't need a perfect diet or a random supplement you found on Instagram to heal. You need a proven system that heals your whole body from the inside out. That's what I'm here to share with you, episode by episode. It's time to make health easy again. And just as a reminder, this information is not meant to diagnose, manage, or treat disease. Always consult with your own health practitioner before you make any changes to your health. This episode has been brewing in the back of my mind since 2022 when my husband took a job who the employer did not provide health insurance. And full disclosure, when I learned this, we loved everything about the employer, the position, everything seemed right, but they just simply were a small enough company that they didn't offer health insurance. And I remember thinking this didn't feel like it broke it was going to be a non-negotiable and something that would make us walk away. But I do remember feeling I really want to walk away from health insurance because doesn't even provide what I want as someone who does a lot of alternative health practices, both as preventative care and to treat symptoms that come up, which doesn't get covered by health insurance. But in general, I was just sick of having to use health insurance and getting hidden fees on the back end where I think something's fully covered and then 2 months later I get a $500 fee for something, which did happen. And this happened so much, I just thought I'm kind of ready to leave the system, but it totally freaked me out. And it took about 3 days, 3 days of what felt like 24-hour research to get my bearings on what it was going to cost to get health insurance outside of basically marketplace health insurance through the government type situation, right? So since then, I have been accruing more and more information of what I learned in those 3 days. Did I actually find the cheapest options and slowly tweaking and learning new things so that we really are literally paying less for our insurance, health insurance, than we were when my husband had health insurance covered by an employer. And we're actually getting more of the types of health provided that we look for, like acupuncture, chiropractic care, supplement coverage, Just amazing, amazing stuff. So, what I'm going to do to frame today's episode is I'm actually going to give you the hard numbers of how much we were like, what our numbers looks like when we were part of Blue Cross Blue Shield of Michigan, what our costs were for when we switched to our new health insurance, and then the health insurance that I learned about 6 months ago. That is what I would recommend to anyone who is trying to escape just the horribleness and the grinding of traditional health insurance while still essentially having health insurance. This episode is about switching, or basically comparing at least, traditional health insurance through like an employer or the marketplace, comparing it to something called cost sharing programs. Now, don't be wigged out by the phrase cost sharing program. It is still essentially health insurance, though they do have disclaimers on their websites for cost sharing programs that it is not specifically health insurance, or like the way car insurance is car insurance and homeowners insurance is homeowners insurance, where if something happens to you, they have to pay you out. But it is based on trust that you're going to put money in at a monthly rate, just like normal insurance. And if you have a claim, you have a coverable, eligible need based off of their requirements or their guidelines, then when you submit that you had something medical happen to you that's covered by them, then they reimburse you. So it's very much like health insurance. You pay a monthly fee whether or not you have a issue come up, and it's stable and it's flat. And then if you do have an issue come up, it gets covered, and you're able to maintain that stable, flat payment. But here's the thing, cost sharing programs end up being far, far superior in many, many cases to health insurance, because they still will cover the cost of major, major issues like heart surgery, right? So you're not just floating off in the middle of La La Land, but they'll also cover things like functional medicine providers, chiropractic care, acupuncture. If you can find a doctor who says, and it's any doctor, there's no in-network, there's no out-of-network. I mean, it's absolutely crazy and beautiful. And again, this might not be true for some cost-sharing programs, but for the ones I'm sharing today, it's true for both of them. All right. So there's no in-network, there's no out-of-network. Anybody who basically has a doctor or an eligible degree, I think it's like naturopathic doctors, I think are covered under it. Chiropractic might be covered. I don't fully know. I haven't tested out all of it. I believe it's any type of doctor though. If they say for your symptom you presented with, maybe it's back pain, maybe it's tummy pain, maybe it's a specific diagnosis like Hashimoto's, whether it's a symptom or a condition, if the doctor says you need this care, maybe it's chiropractic care, maybe it's a certain type of prescription, maybe whatever it is, then it often and frequently will get covered. And again, there's going to be limitations, but it is such a wider catch compared to traditional health insurance that says we will only cover the types of treatments that we have pre-approved, and we will only listen to the doctors who we've already pre-negotiated with. So they have a lot of control over the actions and the treatments you can get before you have even had a problem, which sucks. It doesn't give the power to the doctor to say, hey, this person really needs XYZ. The doctors say, well, you actually really need this, but I can't even mention it to you because it's not covered by insurance. So I have to mention the thing you can get covered, like back surgery. Right. Okay. Instead of like back surgery instead of visceral manipulation. I've had several clients either avoid back surgery or actually finally heal after back surgery didn't help them because of visceral manipulation. But guess what? Visceral manipulation is not covered by traditional health insurance. So that is out of pocket. The cost sharing programs, it would be an in-pocket thing as long as you could get a doctor to say, I agree that this is a good idea. And there's plenty of doctors out there who know what visceral manipulation is. They just tend to be functional medicine doctors, chiropractors, you name it, the things that aren't covered by traditional health insurance. Okay, so my goal is to share these three options with our actually specific numbers. I'm going to give you age ranges. I'm going to give you number of family members to try and give you as close of an apple to apple comparison of how much we were paying each month, what our deductibles were like, and how it's actually cheaper to, no matter what, do a cost sharing program, at least one of the two that I mentioned. And really, the second one that I mentioned, I still think we're going to get into why I recommend it And even though I'm not actually using that one, which is crazy, I hope you guys really appreciate this. Okay, let's jump in. So the first one I'm going to talk about is what we were using in 2022 prior to switching to this employer. It was Blue Cross Blue Shield of Michigan for a family of 2 for half the year. And then in June of 2022, I had my daughter. So then we became a family of 3. And we were with Blue Cross Blue Shield until November with that employer because he was employed by that employer until like the week of Thanksgiving, which is the end of November. So first off, it was very hard for me to find the monthly fees for this Blue Cross Blue Shield program that we had picked. I went to his monthly pay stub and realized, which I had saved for a different reason, and I realized it's not on there. The taxes are on there, his 401k deductions are on there, but because it's a pre-tax expense, they don't have to report it. So you're not going to get, if you look at your pay stub, you're not going to get a monthly or biweekly reminder of how much they're pulling from your paycheck. So like, you're not thinking about, this is costing me money. And if anything, but most things, like if you're looking at a subscription fee, if you're looking at your gas fee or your car loan or your home loan, you want to be able to remember, is what I'm paying for this worth the value of what I'm getting? That is the thing that's going to empower you the most in hacking health insurance so that you get the most out of it for the least cost. Okay. So I did find, you can find this information if you want to know what you're paying. Go to your W-2 it'd have to be for the previous year. There's a box like 12 or 12B. It kind of depends on if you have anything else with codes on it, but it'll be in the 12 section. And there'll be a box in the box 12 section with a code capital D, capital D. Those 2 capital letters have to do with the costs that were pulled from what otherwise would have been your paycheck for health insurance. And so our annual cost for that year for 11 months was $8,641. When you divide that by 11 months, we were paying $785 a month for 2 people under the age of 30. That is the information. Now, I'm about to share some information for what we pay after that. When we switched to an employer in 2022 at the end of the year, we were a family of 3 over the age of 30. And so it's not an apple-to-apple comparison. So I'm going to actually share the apple-to-apple comparison. If we were a family of 2 under the age of 30 for the cost-sharing program New Health, which is what I recommend, spelled KNEW, there's a link in the show notes, we would have paid $490 a month for 2 people, again, under the age of 30. This would have covered all preventative care. It would have covered all functional medicine doctors and labs. It would have covered everything, and we're going to get into more details, but would have covered a deductible of $500 per event, which we're going to get into. It's a little different in cost sharing. It's not for the total year. It's just per event. So like you break your arm, that's an event, or you get bronchitis, that's an event, or you, give birth, that's an event. The whole birth, which the maternity side of cost sharing is a beautiful, but it would have been $490 per month to get way more covered than our traditional insurance covered, because it wasn't covering our chiropractic care or preventative care, alternative preventative care at all, right? Again, compared to $785. All right, that's crazy. The deductible for us when we were in Blue Cross Blue Shield, I think it was like in the 2000 range, and we hit it, right? But then we still had additional expenses. Like it was whatever it was, 2,000, maybe 3,000. It's a little vague because we had a baby that year, so our expenses were like way higher than that deductible. So it was like, okay, we hit it. But then I remember, even though we hit it, we still had to pay an additional $5,000 out of pocket for our cesarean. The cesarean was a total of $15,000. Insurance covered 10, and they said, okay, suckers, it doesn't matter what your deductible was, you're still paying the rest of the 5. So the deductibles are not hard lines, where in cost sharing programs it is. It's like once you hit your deductible for that event, you are not paying any more. There's no like if, ands, or buts. There might be some treatment options that sometimes aren't covered, but it's very, very specific, and it's unusual that they're going to exclude something. So again, as long as a doctor says you need this treatment under a cost sharing program, they're gonna be like, okay, if you need a cesarean, it's covered. If you want to do a home birth, that's covered. Amen to that. That's a huge reason I wanted to switch to Samaritan Ministries, is because at the time that was the only cost sharing program I knew of. That I did check a couple other ones, but I liked that one the most. And I didn't know about New Health, and it covered maternity completely, again, post that deduction. So the deductible is way higher. And then our prescriptions were mostly sort of covered. We're going to get into how prescriptions get covered with the other programs. Preventative care under traditional health insurance is covered. Again, I say mostly because there can still be co-pays, and like if you get a certain lab that's not covered, blood work, markers that's not covered, suddenly you'll have fees that you weren't expecting and you don't know about it until 2 months after the appointment, and it's a total pain. So preventative care is sort of covered by in traditional insurance. Maternity, I like to say it's barely covered, and especially because there's such a wide variety of coverage. I have friends who've given birth to children and had $20K bills that like just because their insurance failed to cover very much. And then I have friends who paid almost $0 because their insurance just happens to cover more. So it varies a ton. And then you feel very disempowered because if you don't have an option that covers a lot, you just don't have an option. And some people literally are not having children because they're waiting to have a better health insurance to cover more of the cost of giving birth. Well, if you're in that boat, you need to pay attention to the next two cost sharing programs I share. All right, bill negotiation. This is actually a line item because in most cost sharing programs that I've seen, there is some support in bill negotiation. They might give you like a booklet or guidelines. Some programs, which one of the New Health, which I'm going to mention, they actually literally will personally negotiate your bills for you. Well, does traditional health insurance cover bills or cover bill negotiation? No, they want to resist the heck out of you. They want you to pay every penny, and you're having to wait on the phone. I remember calling Blue Cross Blue Shield to negotiate some bills, and I was talking to people who were so incompetent they had to forward me multiple times to somebody else to be like, oh, I don't know that answer. Let me forward you to my supervisor. And it just was such a waste of time. Can you imagine? New Health literally negotiates for you. They do it day in and day out. They're experts at it. And it's like an included service just for working with them. Amazing. And then the last thing that's going to be important to cover for y'all is pre-existing conditions. So in Blue Cross Blue Shield, pre-existing conditions are covered. I think that's true for most traditional insurance, that pre-existing conditions, it's like they don't really care. You've had high blood pressure for 10 years, they're going to cover it. That you've had IBS for 5 years, they're going to cover whatever labs or medications or GI docs you see. The caveat to this, I'd say, is they don't cover it amazingly. Like, you're not healed from your problem. And you have to stick with in-network doctors. There's a lot of waits, and no functional medicine doctors if you want to like really go into somebody who, and some of my clients, bless their hearts, have found functional medicine doctors. Like, used to be in the Detroit area, and they'd be like, there's one guy I found at Beaumont. And I'd be like, well, what did he do? And did he recommend these labs? And they still can't order the labs or recommend the treatments that basically a private clinic functional medicine doctor can. They're just more open to things. They're not so hard ass about stuff they're not familiar with. And they're not going to maybe push medications as much, but that's not like true functional medicine. That's like moderate. It's like being a moderate. Yeah. I don't know. It'd be like, this is maybe a horrible, I don't know. Tell me, guys, if this is a good metaphor, but it'd be like saying they're Republican, but they're really Democratic. It's like, no, they're a moderate Republican. They're not Democratic. They're just a moderate Republican. So the doctor isn't like a Democrat or something. They're just a moderate Republican, okay? Like, that's better than maybe a severe Republican if you are looking for a Democratic doctor. So, see, does that make sense? Gosh, I hope I didn't really confuse anyone here. And I'm not pro or for, I'm not recommending either party. But all that being said, it's just not, I find that functional doctors in hospitals aren't really, it doesn't actually do much. So let's talk about some cost sharing programs. Number one is going to be Samaritan Ministries. It's what my husband and I have been on since 2022. And the main reason I have not talked about Samaritan Ministries or cost sharing programs on the podcast in depth thus far is because it frustrates me. As much as I did choose Samaritan Ministries, it frustrates me or made me sad that you have member requirements. You have to be a Christian, you have to attend church weekly, and you have to have a letter from your pastor or leader in the church that confirms that you go to that church and you are a regular attendee, things like that. That's not a hard ask for me and my husband because we already do that regardless of I don't know where we want to get health insurance. And it makes sense. I'm sympathetic to the fact that they are looking to create it. This is not a public good. This is a private thing that people organized who cared about these things. And I'm not angry at them, but it felt to me, well, why would I put it on a public platform like a podcast if I have people who maybe are Christians, but they don't attend every week, or they used to be Christians, but they don't consider them Christians anymore, or they're a totally different faith, or they're atheists, or they don't even think about faith. Like, it just was like, oh, that's a huge barrier for me to be able to really highly recommend to lots of people. But it was my entryway into experiencing a cost sharing program, and it's been a phenomenal experience. Let's talk about the numbers. So for a family of 3, and again, it's going to be 3 to 7, with the primary account holder being between age 30 and 39, we pay $665 in monthly fees. That's already lower than what we were paying with Blue Cross Blue Shield for 2 people. Ha ha ha. The deductible is per event. And I've already gotten into this a little bit, but for both Samaritan Ministries, which is our first cost sharing program, and New Health, which is the second one that is the health insurance hack you've been waiting for. The deductible is per event for both of these programs. And this means that, again, if you break your arm, you have to hit that deductible, and then everything after that is covered. So let's say if you break your arm, you initially go to the ER, you get a cast on, or you get an x-ray done to confirm it's broken, whatever kind of happens first, and you come home with a bill. Whatever that bill is, if it doesn't hit 400, nothing gets covered yet. But let's say, I think with breaking your arm, it probably covers that, passes that $400. And I'm so sorry, but scratch this. Recently, I think it was literally the beginning of September. So this month they did change their deductible to $750. That's a big deal. They did it because they didn't want to raise the monthly rates. It was a way to offset the fact that costs of medicine are rising in the Samaritan Ministries group. I think just like everywhere, both like the inflation of prices, but also how much people are getting sick. And so they are having to raise their rates to simply keep up. You can't like pull money out of nowhere, right? So they're having to at least be like breaking even to fund all this. So instead of raising the monthly fee for everybody, they raise the deductible per event, which again isn't a big deal. Let's say you have 1 event a year, $750 is not a big deal. But if you have 12 events a year, I mean, that starts to get expensive. So you break your arm, you have a bill maybe for $1,500. I feel like that might be low, but I really have no idea how much breaking your arm is going to cost initially for the x-ray and maybe a cast. And then you need PT afterwards to rehab the arm. That PT also gets lumped into that event. So everything related to that broken arm from then on is in that event, and you don't pay anything past that deductible of $750. Now, let me give you another example. I had tinnitus that developed this year, and I talked about it in episode... Oh gosh, I didn't have this prepped. It's episode 225. We'll have that in the show notes. Episode 225, I talked about how I developed tinnitus this year, and I knew I wanted to get some labs done, and I didn't want to have to pay for them out of pocket. So what I thought is, well, I've got this health insurance. I'm going to go hire a functional doctor, get an appointment, tell them my problem, make sure that they agree that they think I still need those labs, order any other labs they think I need. And then when I submitted this, the deductible was still $400. So the cost of the doctor appointment, which was 90 minutes, was $800. The cost of the labs they recommended was $600 plus a lab I have actually yet to complete, which actually could be like a couple $1,000s. It's like an extensive amount of blood work. I paid all that money up front, which is $1,200, but then I was reimbursed, or excuse me, if it's $1,400, I was reimbursed $1,000 just this month. So in the end, I will only pay $400 for the resolution of my tinnitus for anything that I need that I can get covered through Samaritan Ministries. Basically, it's like paying $400 for a 90-minute call with a functional doc plus 2 functional labs plus any other labs that she thinks I need. Now, it doesn't cover supplements. That's the same with New Health. Supplements they're not included anywhere. It's not included by traditional insurance. I've yet to find a place that includes it. But New Health does have a bit of a hack, even though they don't cover it with insurance, that I'm going to tell you guys about. So I hope that explains the concept of a deductible per event. The prescriptions under Samaritan Classic is because I'm so sorry. I think I forgot to mention this. You have 2 options in Samaritan Ministries. You have basic and classic, and they do cover more and less. It's like with Blue Cross Blue Shield, I had bronze, silver, and gold options. And the same with this, you have basic and classic. But under Samaritan Classic, which is what we had, which is the most comparable to what we had with Blue Cross Blue Shield, Samaritan Classic, you can share all qualifying prescriptions for a 120-day supply, including prescribed supplements. Oh, I'm actually reading this. I literally copied it word for word, and I don't think I noticed that about supplements. So it is covered. That's phenomenal. Awesome. 120 days. That is a bit of a sucky window, like 60 days. So 60 days 120 days is going to cover, 3-4 months. So that's going to cover your basic rounds of antibiotics, things like that. And that's nice. Like if you can, like say prescribe supplements, if you can buy all your supplements in that 120 day supply. I'm literally thinking about this off the top of my head for you guys. So you can't pre-buy the supplements in advance. If it exceeds 120 days of supply, then the cost coverage would stop there. Okay, but that's actually better than I thought it was going to be. So all prescriptions and supplements that are prescribed for 120 days supply. Preventative care is not covered in Samaritan Ministries. This is less of a big deal which is why I did it, because if you just have an annual wellness visit for your husband and yourself, then most annual wellness visits when I was calling around and getting numbers was like $125 cash pay, which by the way, most people don't know. So it took them like 10 minutes to figure it out. But then they would say it's usually like $125. And then if there's like a pap smear or something like that, there'll be the additional cost of the lab, which I did have a pap smear and it wasn't crazy. I don't remember the numbers, but I remember thinking, yeah, that's not like $1,000. So very, very reasonable. Where things get expensive with preventative care is well baby visits, because there's a lot of well baby visits in the first year, and then just for children in general, there's a lot more visits ongoing. So this felt like a big wah, wah, wah. And a lot of the places, so when we were in Detroit, I could not for the life of me find any pediatrician who was less than $250 per well baby visit. I was like, what is this? This is criminal. But now that we're in Kalamazoo, we actually found a provider who is in a place called Schoolcraft, Dr. Curtis. He is it's called Wellspring, beautiful, awesome office. And he's like $100 first visit, $75 follow-up for and he doesn't just do pediatric, it's like whole family wellness. Really great doctor. And so just shop around. Just know you get to know your numbers. And that is something I talk about. I'm going to be talking about in the upcoming episode next week is my top 3 tips to accurately estimate how much it's going to cost you to heal. And I'm going to talk a little bit more about calling around and getting your numbers under your belt. But preventative care not covered in Samaritan Ministries. That felt like a big annoyance, but it ended up not being as big of a deal as long as your preventative care is not like monthly or biweekly for $250 a pop with a baby. Maternity, on the other hand, is fully covered. So once you pay your deductible, which right now with Samaritan is $750 as of this month, once you pass the $750, you're not paying any more. So that's going to be prenatal care, postnatal care, up to a certain amount. I know that it covers if there's a preemie baby, so prematurely born babies, all of that is covered. The baby will fully get covered for all of its care. There's there's a whole guidelines, I'm going to put a link to the classic guidelines for Samaritan Ministries classic option in the show notes. So if you just want to pop up it's like a PDF. You can scroll through it on your phone or you can print it and just look through the whole thing. It's organized. It's really great to look at, and you can get a lot more information that way. But maternity is covered, whether it's cesarean or it's vaginal, whether it's in a hospital or a home birth, it's just covered. Pre-existing conditions. This is where things get really dicey because most of y'all listening have pre-existing conditions. That's why you're listening to the podcast. So this is important. But Samaritan Classic shares new qualifying bills for pre-existing conditions that have gone 12 months without symptoms or treatment. Basically, you have to be 12 months, a year symptom free before they're willing to say, oh, you had IBS in 2022 in June, but you haven't had any symptoms since, but you're having IBS symptoms again, so we're going to cover it. It does say certain conditions require a 5-year period without symptoms, unless benign, and treatment or change in symptoms. And that's just a really hard line. That's, again, a reason why I was like, I didn't feel like I had a solution for y'all yet, where I was like, ooh, the health insurance hack you need. So I'm sharing all this to contrast when I share with you guys about New Health, how mind-blowing it is. Now, for bill negotiation for Samaritan Ministries, they give you something called the Blue Book, and it gives you guidance on how to bill negotiate yourself and how to find a provider who will have very low cost, fees baseline. But you have to do bill negotiation yourself and figure it all out. And so it's just like, meh, it's nice that they give me like a booklet and stuff, but it still feels very DIY and time intensive. All right, if you want more details on Samaritan Ministries Classic, because that feels right to you, or you want to be able to compare that, like using your eyeballs in a PDF to compare it to New Health or compare it to your current traditional health insurance, that link is going to be in the show notes to read the classic guidelines for Samaritan Ministries. Now let's move on to New Health. For a family of 3, where the head of the household is age 30 to 39, you have 5 options of 5 different levels. You have a basic all the way to premier, and each level has a monthly fee change with a deductible reduction. So at the basic level, you have a $5,000 deductible per event, so it is pretty high if you think of it that way, and then the lowest amount of monthly fee. And then for the premier level, you have the highest amount of monthly fee, but the lowest deductible. And their current lowest deductible with the premier is $500 per month. Maybe that'll change soon. I have no idea. But as of this recording, it's $500 a month. There are basically no membership requirements compared to Samaritan Ministries. All they say is you have to pay a monthly fee, which is basically you have to pay for your subscription. And if you're a smoker, you will have a higher monthly rate of $112.50 per household, meaning not per person, just per if you and your family and your children are a household, it's just for the whole thing. So for a family of 3, where the head of household is age 30 to 39, which is our family, the monthly fee is $825. This is more. It's like $200, $150-ish more a month than Samaritan Ministries, which if you think about it, if an annual wellness visit is $100, which for me right now, it's like $75 or $100 when I go to see Dr. Curtis at Wellspring. That $150 a month still is not necessarily going to benefit me, again, unless I'm talking about well baby visits, where those can add up and become very expensive. And it depends on your area. In your area, if an annual visit's $250 and you've got 3 children and a new baby on the way, yeah, that's going to rack up. And that $825 a month is overall going to be lower because preventative care is fully covered in New Health. So again, New Health suddenly, it's just there's no membership requirements. The monthly fee covers preventative care, which is really powerful when you're talking about families. For their families, it's 3+. So as soon as you have a kid, this fee never increases with more children. So again, super family friendly. Your deductible, like I said, is $500. I think you guys understand the concept now. You break your arm. Even if you end up paying on the front end, you will get reimbursed everything except for that $500 you paid towards the broken arm issue. Prescriptions, this is actually really nice. So prescriptions for medications which are related to an eligible need and are billed by a provider are considered shareable, and they are shareable for 12 months. So it's the same thing. They kind of it has to be an eligible need. It has to fit under the same normal requirements as things in Samaritan Ministries, but instead of it being 120-day supply, the sharing for this prescription is limited to 12 months. I don't know if that's a 12-month supply or just 12 months of buying that said prescription. It doesn't mention anything about supplements here, and I realized there might be something in their guidelines booklet on supplements, but I didn't look. I am providing the link to the New Health membership guidelines, which will share those similar kind of nitty-gritty details in the show notes. So go check there if you want to know the details on supplements. Maternity is fully shareable in the exact same way as Samaritan Ministries. Pre-existing conditions. This is way better. This is what almost sold me. And I was like, I have to share this on the podcast. I have to share about New Health. I have to. It's not perfect, but it is way more flexible. So year one of being in New Health, you can have $0 that gets covered. $0 can be covered for a pre-existing condition. Okay, this sounds like it sucks, but year two, it's $25,000 maximum. And year three, it's $50,000. Year four, it's $125,000. And after year four, then it's going to stay at $125,000 in a 12-month rolling period, resetting each membership year. So it's like, if you joined in June, you don't have to wait like an additional 6 months for like the beginning of December or January to start. It's just whenever your membership started. I have a client right now who is starting with New Health, who has a pre-existing condition. I think it actually is her daughter. Her daughter has the pre-existing condition. They're keeping around their health insurance, and they're starting New Health at their lowest membership option, just to start that year one. And they're barely going to even use it, if at all. But then they'll have a year of membership under their belt. And year two, they could like bump up their membership so that their deductible isn't as high. They'll pay a higher monthly fee, but then suddenly $25,000 worth is going to be covered for that existing need. And let me tell you, I have never had a client pay $25,000 to heal their gut when they go through my program. So I can't guarantee you won't need $25,000. It kind of really depends on the need or the problem you're dealing with and the solutions that end up being suggested to you or required of you. But there's a lot of things that I've seen for functional medicine wise, you're not going to need $25,000. That's really starting to look at surgeries. You're going to start getting in that $25K level of things for things that honestly a traditional hospital is going to be covering. Which again, I can't guarantee that, but it's just when I'm thinking through $25,000 on year two, it's not as much as year three or year four, but it's still a lot. Super, super powerful. And I did look their smallest annual membership for New Health, their cheapest plan would be an individual age 30. Well, let's say it's not an individual, and let's say you're age 30 to 39. Their cheapest plan for their like basic is $178 a month. So you pay $178 a month for 12 months, and now you're in year two, and you can bump up to a higher plan that has a lower deductible and get some of that pre-existing condition covered. So here's the other thing, and here's where things, my brain was just being blown as I went through New Health's website, and they have even more. You just can't even compare it suddenly with Samaritan Ministries. You get a $200 annual wellness allowance. So if you want to go to a chiropractic appointment and it's $50 and you just want it covered for wellness, you can use that $200 annual wellness allowance and have that $50 covered. That's the same with I think massages, things that might not be prescribed and you just want it to be a part of your wellness. They just give you $200 that you can put towards that. Crazy. You get FullScript access with wholesale pricing. Now, FullScript is an online supplement dispensary. That's what I use with my clients. My clients get 10% off, but when you are able to directly connect with them, you're able to get wholesale pricing, which is 35% off of supplements. It is mind blowing. So you are going to get supplements the cheapest you could get them ever. It's wholesale. It's like, I don't know, buying at Costco, but even cheaper for supplements. And it's really high quality supplements. Some supplements, which you can only get typically if you have a provider with a like registration with that company. So like stuff you can't even get on Amazon. You have to have a direct relationship with the company. You get an online workout library called fitonhealth.com. I'm going to put a link in the show notes if you want to check them out. They do build negotiations for you. And then they have some other things that I looked into and I was really underwhelmed with, but they like make a big deal out of it. You get 2 free wellness and or life coaching sessions a year. You get some discounted labs. I really felt like it was very limited. And so it was mostly blood work. It wasn't like functional medicine labs. I just felt like it wasn't that helpful. And then some free labs, which also were like even more basic blood work. So I was like, they say like free labs. And I'm like, nah, but I was really underwhelmed personally, but you might really like, if you're going to have to get blood work anyways, and it can be free, why not? So before we jump into a little bit, let's make a little bit more on like strategies for switching. Because I do want to talk about if you're like currently have a pre-existing condition or you're like freaked out by not having traditional health insurance. Because if you are used to it, it feels like you're jumping off a cliff. That's what it felt like. I felt like even though I hate traditional health insurance because I always had it and because everybody around me always had it, I'm like the first person in my family and my immediate friend group to go outside of traditional health insurance. I just felt like I was jumping off a cliff because it seemed like, well, if it was this good outside of traditional health insurance, wouldn't everyone be doing it? And so maybe there must be some hidden thing. It's not really trustworthy. And my brain kind of was like, and that's me. That's me who like hates health insurance and find it completely useless. And again, you don't have to feel that way to switch. That's just me where I'm starting at. And it still freaked me out. So you might be thinking, well, what about vision and dental? Because typically when a health provider or an employer is covering your medical, it also includes vision and dental. Well, you can actually opt out of medical health insurance and still keep your vision and dental if you have an employer who offers it. Vision and dental is way cheaper than medical. It is a fraction of the cost. It's like usually we were paying for Cobra for a little while after my husband left his health insurance as I was figuring out basically not how to not have traditional health insurance. And the vision and dental was like, for both of them, I think it was $47 a month that we were sending to continue vision and dental with Cobra, which I can't remember if the rate's exactly the same as the employer. It's either the same or it's a little higher. So it was like maybe $25 each per month, which is it's not like $700 a month that you're going to be paying for medical health insurance. So generally vision and dental too, I looked at them through just buying on the marketplace and it still was more generally affordable. I chose to do cash pay because when I called around and said, hey, how much is like a annual teeth cleaning and, things like that and x-rays and a exam from the doctor, and I was given the numbers, it was just super doable and it wasn't a big deal. On top of that, we ended up going with a program working with a dental company, Aspen Dental, where you can pay $39 a year and then plus an additional cost if you have additional members like a spouse, children. And you can get 100% off your exam, 100% off of your annual x-rays, 30% off your cleaning, and like 30% off this, 30% off that, 10% off this. And it immediately just makes the annual cost for just like cleanings and general care of your teeth so much lower. And honestly, lower than what I was going to have to pay for insurance. Now, this is a risk management and risk tolerant choice because if something happened to my teeth, like I need a crown, I don't have insurance. At the same time, some of y'all might already know that sometimes crowns and dental work isn't covered nearly as much as they like you to think, and there is still a lot of cash pay involved. So I do encourage you to shop around at different dental offices and ask them what's their cash pay prices like. Generally, dental offices and vision offices know it faster and easier than medical. Medical has no idea how much anything costs. Dental and vision tend to much more easily. And there's very much even if you Aspen Dental is a big franchise, and I think they're nice enough. But if you're looking for more like a local dentist who offers more of a holistic approach or sensory friendly or whatever it is. Those exist where they also offer their own monthly subscription option. And a great example is the dental studio that I used to rent out of, Dexter Dental Studio in Dexter, Michigan. And I'm putting a link in the show notes just so you can see an example of what the prices are to be in their membership. And again, it's not a big franchise, but it's like I'm looking at it. It says monthly adult subscription is $38 a month. Annual adult subscription is $3.99. And when you're in a subscription, you get 2 dental wellness visits with each routine exam, dental cleaning, oral cancer screening, and digital x-rays, 1 problem-focused exam, probably meaning like my tooth hurts, so I'm going to just show up and have a problem-focused exam, 1 periodontal evaluation, and a 20% discount on most additional services. And that's just a local dental practice that says if you don't have insurance or you don't want to use your insurance, here's another option. And in general, I found that vision had similar things, though vision has typically less catastrophic eye problems, and you can get very affordable glasses online. You just get an exam and you buy it like I buy direct, which is where I've gotten glasses for like, I think, I don't know, $50 out the door, something like that. Just crazy low prices. And this is prescription, right? Prescription with like anti-glare and like, I don't know, like filters in it and stuff. So very doable. Get your numbers, and you'll feel empowered. You will feel so, so empowered. So again, if you're listening and you're like, how do I have a strategy to switching? I would first say, just know what your local cash pay numbers are. That really helped ground me in being like, okay, even if my new insurance doesn't cover this is what the number would be. That really helped me feel. And keep in mind, you won't be paying. Your paycheck, like if you have an offer from your employer to get health insurance, typically your paycheck will increase when you opt out of that health insurance. So you're going to suddenly make $500 or $1,000 more a month because of opting out, right? So talk to your HR department if you have an employer to see how much more money you're going to make in your paycheck. And that's going to give you a lot more leeway to both pay for your health cost sharing program and maybe any uncovered costs they don't cover, whatever it is, or honestly, a savings account for your health, beautiful things like that. Switching to cost sharing has enabled us to save even more money per month into just a typical high yield savings account that is for health related expenses. And it's our own version of an HSA where we can determine what we want to use it on. Now, it doesn't come with tax benefits and all that stuff, but we can use it on what we want and what we actually find makes us healthy. Just mind-blowing. So I already mentioned the idea that a client of mine is going through, and if because of a pre-existing condition, you need to hang on to your health insurance, traditional health insurance, you can get the cheapest plan on New Health. I would talk with a advisor to make sure, do you need to be an individual or do you need to be on a family plan for their cheapest plan if you're going to like change your plan level in a year, like so that you can get that $25,000 coverage for a lower deductible. Just talk with one of their advisors on New Health. They're super friendly. They're very responsive. It's not a long wait if you call them, but you can go check out the New Health membership options in the show notes that I have, and you can see the exact pricing for your age range, the number of people in your family, and the different plan levels. You can go to see New Health services in the show notes, and you'll see all the things that I already mentioned, but there'll be links. You can see details on like what labs are free, what labs are discounted. You can read the New Health membership guidelines. If that'll give even more details on what types of treatment plans get covered, what type of illnesses. They mention like Lyme disease in there, for example, and they have it's really great stuff. So I hope that this feels like the biggest hack. I know it doesn't mean like it solves all your problems. There's still things to work through, pre-existing conditions, whatnot, but it gives you options. Even if you choose not to go with it, you can feel more confident that the health insurance you currently have is the better option for you at this time. I mean, that's just worth knowing that you shopped around, you looked, and you now know, no, actually what I have is the cheapest, covers the most, I'm getting the most out of it for the least amount of cost. That is the health insurance hack. And if you specifically want all functional medicine appointments and labs covered, either Samaritan Ministries or New Health is going to do it for you. I hope this is mind-blowing. I hope you can share this with a friend. I hope it gives you just something to chew on and mull on and look through, because you can be more empowered in your health. And I hope that is my desire and my goal to get you one step closer. I hope you guys have a great rest of your week, and I'll see you guys next Thursday. Hey friend, I hope you loved this episode. If you've been a fan for a while or newly loving this podcast, can you do me a favor? Drop into Apple Podcasts and leave me a review. When you leave a review, you do so much. You help me know you're listening. You can tell me what you're loving so I know what to make more of. And you help others by boosting this podcast so other people like you can find the podcast too. I mean, it's a win-win-win, right? So if you want a way to pay it forward, just go to Apple Podcasts or click the link in my show notes and leave a rating and review. And if you want some more free stuff, just head over to my free Facebook group, betterbellytherapies.com/Facebook, and you can get access to all of my free support for you, including some Facebook group exclusive stuff like my podcast episode vault, where you can search the Better Belly podcast by topic and find exactly what you need to expedite your healing. I cannot wait to see you in there. Catch you guys next week.